Good afternoon and welcome to today's Dr. Anyoha's podcast and presentation. Today, I am going to be talking about fungal infections of the skin, also popularly known as ringworms. So, today I am going to be talking about ringworms or fungal infection of the skin. Ringworm is a common infection of the skin as shown in this picture. This is a young boy, could have been a girl, who presented with a rash behind her back. I think she or he was brought by a mother for this rash. If you look at this rash, you see how circular or somewhat circular it is. And this is classical presentation of ringworms. A ringworm could occur in various parts of the bodies. It could occur on the skin of the trunk, that's from about neck area to actually the thigh areas or even lower legs, any part of the body. You can find ringworm there. And sometimes it comes in odd places like behind the ears, around the ears, on the jaws, on the cheek, and for this kid is behind the back. So there is this kind of ringworm that occurs on the main body is called tinea corporis. Tinea corporis is a medical term for ringworm that occurs on the body. Ringworm can also occur on the scalp, on the head, and when it occurs on the head, it is called tinea capitis. You don't have to remember that, but you should remember that ringworm can occur on the scalp of the head. That's the thick skin covering the head where the hair grows. And also, ringworm can also affect the foot, the foot or the web of the foot, called athlete's foot. So you can have ringworm in between the webs of foot called athlete's foot. So that is a third area where ringworm can occur. And also ringworm can occur in the area between the external genitalia and the inner thighs. And it's called the tinea cruris. And it makes people itch away. A lot of scratches in the groin could be due to ringworm. And of course, the other common area ringworm forms is ringworm can affect the nails, either the toenails or the nails of the fingers, called tinea unguine or onychomycosis. So these are the areas ringworm like to affect. So ringworm is, like I said, it's caused by a fungal infection. It's also called dermatophytes, which means they love the skin. They thrive and they eat the skin. They get their nutrients from the skin. So they love the skin, they love the nails, they love the hairs. And that's why they grow. They can attack the skin, they can attack the scalp and the hair, and they can attack the nails. Now, to understand ringworm, you should understand that various bugs can cause skin infection. Bacteria can cause skin infection, viruses can cause skin infections, fungus causes skin infection known as ringworm. So that is what we're talking about today. Again, infections caused by fungus known as dermatophytes, and those infections, as enumerated, could cause a ringworm on the body, which is called tinea corporis, ringworm of the scalp, which is called tinea capitis, ringworm of the nails, which is called onychomycosis, and of course, ringworm in the groin, which is called tinea corporis. And of course, I forgot the ringworm of the foot, called athlete's foot. So these are the areas ringworm can occur. How does it present? How does ringworm present? Now, ringworm presents in various ways, and the in children, or in fact, in most people I've seen, the presentation, the rash, is discovered by somebody else. For example, this kid with a rash behind the back. There's no way this kid could see this rash behind the back. So probably a mother or an aunt or a sibling had discovered this right behind the kid's back, or sometimes the rashes are noticed by classmates, like, hey, there's a rash on your cheek. And when somebody looks in the mirror, they see the ringworm. So sometimes people around the patient, or the mother or the father or an observant brother, sister, would notice a rash and points it out to the patient or to the guardian, and that's how the patient come to the doctor for diagnosis and treatment. And of course, parents could also notice that a child is scratching away, itching a particular place of their body, either the groin or the foot or any part of their body they're itching, and upon closer observation, the parent will notice that something is growing, something is developing, and that gets their attention, and then they will bring the patient to the doctor who identifies ringworm. Right here in this picture, this ringworm is very clear cut. It's circular. If you look at it, it's like a almost circle. Now, mostly ringworms of the body, on the body, could be one, mostly one. Uh, Rash, it could be small as a coin, a quarter, or it could be as big as the 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 top of a big wristwatch. And usually, you can see one, sometimes two or multiple, but usually one rash somewhere on the body. This is tinea corporis. So this one that here is very clear cut. Now, in the beginning, it wasn't like this. It's usually some hard to see scratchy surface in faint rashes on the body, and which over the time becomes clearer and clearer until you can see the circular lesions. So depending on what stage of progression, it could be easily identified or it could be hard to identify. I usually sometimes step out to glance at the rash to see the circular nature of the rash, or this rash is going to form, or this rash, when it forms uh, in its entirety, is going to be circular. So sometimes you have to look at a rash at a glance to realize the developing circular nature of the impending tinea corporis. This is to say that it's not always clear. Sometimes it takes a very experienced clinicians, a very experienced pediatrician like me to diagnose ringworm, especially when it is beginning to form. Now, when it's clearly formed, like the rash in this picture, even a medical student or a physician assistant student or a parent could tell, who've seen ringworm before, could tell this is a ringworm. But in the beginning, it's sometimes difficult to tell. The same thing goes with ringworm of the scalp. So ringworm of the scalp obviously is caused by the same organism, which is fungus. it can, like I said before, it can affect the skin of the body. It can also affect the scalp, which is the thick skin of the head. So ringworm of the scalp, when it clearly develops, could also look circular in nature, but like all rashes, at the beginning it's very difficult to tell. It could be a small patch of area, small area where a child is losing their skin on the scalp, and later on there will be some scaly lesions like the back of a fish, and as the rash progresses, the that area becomes more bald, and then the rash becomes clear. That is a circular rash developing on the scalp. And that's when it becomes obvious that this is the ringworm of the scalp called tinea capitis. At that point, parents or caregivers are ready to take the child to a pediatrician, a doctor who knows about ringworm. So the same is applicable to wherever ringworm comes, like the ringworm of the web of toes called tinea pedis, athlete's foot. Somebody could have excoriations between the web of the foot, and which, if seen by clinicians, could be ringworm. And we also talked about tinea corporis, which is ringworm affecting the groin, causing the patient to be scratching away. And the very tough one is ringworm of the nails. I've seen some kids, some adults or young adults have their nails destroyed by ringworm of the nails. They're called onychomycosis. So how do you get ringworm? Okay, ringworm are usually very contagious. Could be passed from somebody who has it to somebody else. So it goes from one person to other through close contacts, like people who are wrestling. If somebody is wrestling with another person with ringworm, they could rub off the fungus on their opponent and they could get ringworm. Or if somebody can get contaminated if they were to put their hands or arms or forearms on a table occupied by someone with ringworm who left the fungus on the table or other surfaces, sharing towels, rag, and so forth. And also there could be outbreak in school, in classes, in daycares, and so on and so forth. So this ringworm is passed from one person to the other. It's contagious. And of course, a person who has a ringworm of the body, as shown in this picture, can scratch that and transplant it or relocate it to the scalp. So you can transfer the ringworm from your body, one part of your body, to the other. A ringworm of the body, like shown in this picture, can be scratched and transferred to the head or scalp, where it causes ringworm of the scalp. Ringworm of scalp, by the way, is called, in my language, Igbo language, is called Obusi Elingo, which is to show that you could have your hair removed free of charge when you contract a ringworm of the scalp, because the part of it is to destroy your hair and leave you with bald spots. Patches. It could be one patch, one big patch. It could be a couple of patches, and sometimes ringworm of the scalp could be very painful and inflamed. And if you touch it, it's very sore. And of course, coupled with hair loss and secular lesions. That's how you diagnose ringworm of the scalp. What is the treatment? Usually, when I have ringworm of the body, which is, like I said, it's called tinea corporis, especially if it's starting. If I catch it very early and it's starting and the rash is not entrenched, I will start antifungal cream. The antifungal cream I use is called clotrimazole cream. I can use ketoconazole cream as well, and it's a couple of times a day until the rash disappears. So that's how we treat ringworm of the body called tinea corporis. Also ringworm of the web of the foot, athlete's foot, is also treated with creams, antifungal cream or antifungal spray. That also is very easy to treat. So both ringworm of the body and ringworm of the web of foot could be treated with antifungal cream. Most times, taking medicine by mouth is not necessary. But sometimes, when you have an entrenched and persistent ringworm of the body or tinea corporis, like shown here, that is not going away, it is okay to treat that with oral antifungal medications. What I like to use is cruciformin, which is taken daily for about 30 days. I like that. Other times, other times I use fluconazole, which is taken once every week for about 5 weeks. Now, the downside for cruciformin, which is an oral antifungal medicine taken by mouth, the downside is that sometimes it's very bitter, and kids don't like to take bitter medicine, and you take it for a long time, 30 days, once a day for 30 days. So that could be very challenging for kids to take. So sometimes I end up using fluconazole, which is once every week for 5 weeks. All right, so that's treating ringworm of the body. For ringworm of the scalp or the head, we have patchy scalp lesions of your head. Like I said, it could be one big patch lesions or rash on your scalp, top of your head, or it could be multiple. Once I make a diagnosis, or once I see that a child or a kid or a young adult has ringworm of the scalp, I'll go ahead and put them on oral antifungal medication. That means medication by mouth. I don't even try the cream, antifungal cream, because antifungal cream ointment applied to the rash, to the ringworm of the scalp, does not work as from my experience. So I go ahead and start the child right away on antifungal oral medication. If I'm using cruciformin for 30 days, if I'm using ketoconazole, is once a week for 5 weeks. So that is how I treat ringworm. This is how I make a diagnosis and treat ringworm of the body, the scalp, groin, and the web of the foot. Now, ringworm of the toenails or the fingernails are harder to treat, and sometimes you can have patients on oral antifungal medication for months and still is not well treated. And you can have them on antifungal solutions, uh, applications on their nails, and still it's not well treated. So I will devote another presentation for ringworm of the nails because I think very challenging for people, and we have to devote more time to talk about ringworm of the nails, which is called onychomycosis, because this is very hard to treat and is becoming very prevalent as far as I'm concerned. A lot of people are calling me with problems regarding nail fungals destroying their nails. So how do you prevent this? The prevention of ringworm is to obviously to wash your hand regularly because you never know where your hands had been, especially touching objects, sitting on a chair and placing your hands, and it could contract ringworm if a person with ringworm had been on that table previously. And of course, taking a bath and washing your body thoroughly with soap and water when you come back every day. So that could dislodge any fungus trying to implant or dwell on your body. That's one way of preventing ringworm infestation is cleanliness, hand washing, taking a bath, and and of course socks if you are walking around, because if you're walking around barefoot with no socks or no shoes, you could contract tinea pedis or ringworm of the foot, especially in locker rooms where people walk barefoot without slippers. You can contract ringworm of the foot from people who have ringworms who had walked on the same floor. That's one way to prevent ringworm is to avoid contaminated objects. And how could you avoid them? Is to be mindful of them and to, of course, wash your hands and take a shower when you come home from work. So most ringworms are usually diagnosed clinically. Clinically, a a good physician, a good pediatrician should be able to eyeball a rash and tell whether this is a ringworm or not. It's not very hard to do that, especially when you've seen a ringworm before. It's very easy to make that diagnosis. The secular rash, the elevation of the thickening of the periphery of the rash, if you look closely, and of course, after some time, the center of the rash begin to clear and the edges are rest. So that's a classical definition of the rash. As you see here, the edges of the rash are raised, but there is some central clearing of the rash. In other words, it's not as thickened in the middle as it is on the edges. So that is the classical tinea, rashes or fungal infection of the skin. If you are treating a rash that you thought is caused by fungal infection or tinea, and the rash is not going away, it could be one of two things. It could be that you're not using the right amount of medication, especially if you're doing medication by mouth, that you're not using in the right amount of medication, the dose. Your dose is off, way off. That could be one. Number two, it could be that your diagnosis is wrong. In other words, not everything that is secular and look this way is ringworm. So once you you are treating this rash for a week, 2 weeks, and the rash is not budging, you probably should reevaluate your diagnosis or redetermine your diagnosis or have somebody else take a look at it and see if you're right. But if you're right, and if it is indeed a ringworm, you should start seeing resolution in a couple of weeks. And of course, if you're treating the ringworm with the wrong thing, it's not going to go away. For example, if you're treating ringworm of the scalp with a cream, with antifungal cream, you're not likely to get any resolution. Your patient will not get better if you're treating an entrenched ringworm of the scalp with antifungal cream. So you have to mind the dose of the medication you're using and make sure you're treating it appropriately with the right medicine. Make sure you're treating the right ringworm with the right medicines. I think I'll end here, and please share this presentation with your friends and family. What I'm doing here is whether you're a parent or a medical student or a doctor, or especially newly graduated doctors or a resident, that I'll give you enough information to start recognizing ringworm, and if your parents getting help from your pediatrician or from your doctor, and if you're a doctor to be able to treat ringworm adequately. Thank you so much for listening. This is Dr. Anselm Anyoha.